All right, there we are. Hey, everyone, welcome back. Here we go. Another Conversations on Vitality. I'm your host, James Gardner, as always, with Ariel Jarvis on the other side of the mic. Hello, Miss Jarvis. How are you today?
I'm good. How are you?
I'm good.
Good.
Good. I'm excellent. Thank you. Happy October to you. Happy Halloween
Yeah.
month of Halloween. Fall is here in the air for sure.
You wouldn't know it though, looking at my Facebook yesterday. We were out on the boat,
I
water
know.
skiing, and I was like, technically it's called wake surfing, so it's a whole new term. And the water was so warm and it was so beautiful, and it's October. I'm like, is this August or what? It's crazy.
I know. I know. We've had some really nice days here in the Pacific Northwest for sure. But make
Yeah.
no mistake, the dark gloom is coming as it always does.
Yes.
Get that vitamin D ready. All right.
Yes.
All right, gang. Today we're continuing our series of the body systems, 11 body systems that we have to deal with every day. Today's conversation is around the urinary tract and all its magnificent parts that make up how we process and deliver waste. Or excrete waste, I should say. So, Ariel, let's dive in. Let's educate and have some conversation, and then offer some solutions for some conditions that people may be dealing with.
Yeah, absolutely. So we always like to break it down. So, what is your urinary tract made up of and comprised of? You have your two kidneys. They look like little beans and they're located in the lower back. So, if you ever have lower back pain, there could be a couple contributing factors, but maybe you're just not drinking enough water. The second one is you have two ureters. And so you also have a bladder and urethra. So that composes your urinary tract. What happens is if you don't drink enough water, then positive charged particles can develop as plaque, just like you can get plaque on your teeth. You can get plaque on different surface area components of your urinary tract, and then it can't filter the blood properly. Your kidney system and your urinary tract's job is to remove harmful chemicals, toxins, debris, um, balancing out hormones, moving acid waste from the blood, and working on the lymphatic system. And so, if you don't have two kidneys, you need to take care of the one kidney you have, right? We have
Mm,
two for a reason. It's because if we lose one, that's okay, but you really need to be mindful about that one that you have left. So, it's very, very important. And we'll talk about how to maintain a healthy kidney function.
okay.
So, if you want more for prevention, then obviously drinking a lot of negative charged water. Remember, magnetism, negative is attracted to positive, right? They bind. So, if you have a lot of positive acid waste building up as plaque in your kidneys, by drinking a lot of negative charged water, you're going to be flushing that and removing it. And so we have a couple little supplement recommendations that pair very nicely with this called chlorophyll, green inside, clean inside, as well as K, not vitamin K. Ours is called Kidney Care. Has cilantro and parsley and a bunch of other wonderful bioenergetic herbs to actually help kidney function, which will help with water retention, and it will help with lymphatic drainage, heavy metal detox, and allowing those kidneys to function optimally. Um, so what does the kidneys do? We know it cleans the blood. We know that's very, very important, but it also removes acid waste, which is the byproduct of a lot of our foods. One food in particular that we says is the most important macronutrient, however, the most damaging to the kidneys is protein.
Mm,
Okay. So yes, it's like a very confusing contradictory because you need so much protein for a healthy body, amino acids, white blood cells, all that sort of stuff. But you also don't want to have too much uric acid, which is the byproduct of consuming it, which is going to be really harmful to the kidneys. So that's why water is so important, and not just fluids, right? Not just things that have water in it, like tea, coffee, alcohol. You actually want to drink negative charged water to remove that. And some of the things that can really cause harm to your kidneys, we'll talk about. It's smoking, it's alcohol, it's too much coffee consumption. Remember, things in moderation, your body can kind of balance out. But if you're overdoing it, then your body is just going to become overloaded and burdened in a specific area. And so medications can be really hard on it. and also emotionally. What people don't realize is emotions, energy in motion, actually can get stored as harmful energy in the body. So, in Ayurvedic medicine and Chinese medicine, we always like to talk about different organ systems with different emotions. Your
Mhm.
kidneys have a huge correlation with fear. So, fear affects the fight or flight response, which is the adrenal glands that sit on top of the kidneys. And
Mm.
so when you hold a lot of fear in your body, you're just a very fearful, you worry a lot, worry yourself to death. You just worry a lot, you have a lot of fear. That actually that really affects your kidneys. So maybe you're in a situation where you're always in fight or flight, you're always worried about, making ends meet. You're worried about a loved one, like, things like that. So if you are someone that's going through a lot of fear in a phase of life, throw in some chlorophyll, throw in some K, and allow those kidneys to support naturally. And if you are someone who's had a kidney removed or you are on dialysis, then you'll actually notice that you're going to have issues with your water levels. So I have a patient who actually had a lot of water building up behind his heart. Just by getting him on K, which is like a natural diuretic, we were able to actually pull all the water out, and he didn't have to have a surgery, which was amazing, right? Because
Mm.
open heart surgery, who wants that? It's
Right.
very invasive. And so there are always remedies for anything that is, pretty extreme, but always, consult with a practitioner to get multiple advice first.
Ariel, okay, so we established the importance of the kidneys here as part of the urinary tract. At the end of the day, is the function of the urinary tract specifically just to remove waste? Is that its job, the system
It,
itself?
its main job is to keep the blood clean.
Ah,
Yeah.
and then by doing that, it filtrates and then it creates the byproduct, the waste that
Yes.
goes out. Okay.
Yes. And so its only job is to keep the blood clean. But if whatever you're putting in your body is throwing off your microbiome, maybe your candida, your yeast, your bacteria, maybe it's
Mm.
really acidic, all this sort of stuff, that waste is so concentrated when it goes through the kidneys and into the bladder and then out, through into the washroom, then what happens is sometimes people can get UTIs, bladder infections,
Yeah.
things like that, right? So we actually have a product called Uva Ursi, which works amazing for bladder infections. You would take that with K if you have a kidney infection or if you have kidney stones. Remember, this is concentrated waste now, and it can get hard, right? Or if you're somebody who gets yeast infections a lot on the outside, then you can use an actual probiotic, insert it with some silver gel to establish a healthy equilibrium and ecosystem and pH balance.
Mm. So you mentioned bladder infection. So is that a result of too much acidity coming through from the kidneys?
Correct.
Okay. Hmm.
Yeah, basically there's just too much waste coming out and you didn't dilute it enough with enough water,
Right.
and the waste that was coming out was so acidic and so bacterial ridden that it didn't clean properly. Some people can also have bacteria entering the other way, so not cleaning properly
Right.
after being
Right.
intimate, right?
Right.
So just making sure you're having proper hygiene to protect yourself.
Okay. So let's go back to kidney function. Obviously, someone near and dear to both our hearts actually is operating on a kidney. So what can people do to really? I mean, you offered a couple of cleaning solutions. What do they have to be mindful of? What can they do to really get those kidneys?
Yeah.
You know,
So I always
fire.
say when a kidney's been removed, then there's really nothing you can do about that specific kidney. If it's still present, remember your cells turn over every 25 days. So through basically giving the body and the cells what they need, you can have potential around getting a kidney back to function. But let's just say you only have one kidney, then it's very, very important to take a look at your stress load, your rest and digest, right? Making sure that you're within balance because you're already a little off, and making sure that you're taking a look at your acid waste. So get yourself on negative charged water, drinking your 3 to 4 liters a day. making sure that you have, unfortunately, a lower protein diet. So you wouldn't eat your full body mass in protein. You would probably cut that in half, unfortunately. And then just making sure that you are not consuming any alcohol, zero, no smoking, no medications, and very limiting your coffee consumption, and zero carbonation, no Diet Cokes, no Diet Pepsis, nothing like that. And you can actually put frankincense on the lower back, essential oil on the lower back, to help with stimulation of that kidney, and making sure that you're taking chlorophyll 2 to 3 times a day, and the supplement called K, and that will be like the toothbrush for the kidney wall. That will support you so that you have proper kidney function. If it is a little bit sluggish, it cleans it out. And if there is any like debris or stones or anything like that, it will remove it so that that kidney is the best that it can possibly be.
And if that kidney is not that one kidney in this conversation is not operating optimally, what would be some of the signs and or symptoms that someone may experience?
You'll have puffy eyelids, so underneath your eyes will be super puffy. You'll feel like you're holding water retention. You'll have a lot of broken varicose veins. A lot of capillaries are broken. Puffy ankles, like some edema issues. You can have lower back pain, chronic fatigue. You can have digestive issues, bloating issues, anything digestive. And as well as it does affect your hormonal system because it's so close to the adrenal glands, right? Because they sit on top of each other. So because it's in the lower back as well, it's so close to all the nerves back there. So some people can even have nerve pain where it shoots up their back, or maybe it goes into the butt cheek, the sciatic, or just chronic headaches.
Okay. Well, there you go. Kidneys are an important thing, obviously, as every part of our body. Ariel, I have a question for you. Because we talked acidic waste, we talked uric acid, things like that. In the past, you've shared with us what we can learn about our diet and our health from our stool, by examining stool. So, is there things that we can learn or understand from our urine?
Yeah, absolutely. So when you're properly hydrated, your urine should be clear. When you first have your first urination when you wake up, because you've been sleeping for 7 to 9 hours, you will have color. So that's normal. Any urine after that should have no color. The smell should be very limited. If you have a very bad smell, that is not normal. That's too much ammonia.
Yeah.
And if it burns, that's bacterial. And if you have stabbing pain in your lower back when you pee, then that could be kidney stones, right? So there's a couple little things to look at and think about. So the best thing you can do as well is I always put lime juice in my ionized water, my negative charge water. And that acts as an extra boost for your kidneys because it removes any mucus that can be built up and any blockages in those little ureters, right? They're these tiny little tubes. So you have your big kidneys, you have your little ureters, you've got your bladder, right? So sometimes when you're going from a larger area to a smaller area to a larger area, sometimes there can be a blockage in there, right? So all these little things. So that's why you have to dilute, because all that acid waste coming out, you don't want it to be leaving any bad bacteria behind or anything behind that can cause the bacteria to grow up and be attracted to go into a different area, a different destination, and colonate.
You said lime juice, lime, not lemon. Lime?
Correct. Lime.
Cool.
Yeah.
Okay.
Yeah. Lime works on mucus. Lemon works on liver.
Oh, look at that. I like that.
Yeah. And lime juice is also less harmful to your enamel for your teeth. So because I drink it all day, I'll drink it with a straw. And that way I'm protecting my enamel and my dentist will thank me.
Right. Nice. Okay. So lime acts as a mucus, helps remove mucus in the kidney. Okay. So putting that with some water will further help create that
Yes.
flow. Excellent.
And in
Okay.
terms of nutrition, right? Watermelon is great for your kidneys. Cilantro, parsley, anything that is a leafy green, except spinach and kale. Spinach and kale must be lightly steamed or cooked because they have oxalates, and those can develop into kidney stones. So just be very careful with those two.
Wow.
It's very specific.
Yeah. Interesting. Never.
Yeah.
Okay. Oh, because that's all I eat is spinach and kale.
Make sure it's lightly steamed so you can throw it in your tofu eggs.
What you talking about, Willis?
I don't know. I feel like you don't do eggs. I feel like you do some kind of.
I do. I do eggs.
Okay.
I do eggs.
So throw that in your eggs. Yeah.
Okay. All right. Wow, look at that.
No judging.
Okay. So kidneys. We talked kidneys. We talked the function of the kidneys. We talked some solutions, which really, if I'm correct, the two main protocols besides ionized water would be the chlorophyll and the K, which is a combo of kind of cilantro and so forth, right?
Yes. The last thing I want to mention too is if you see blood in your urine, and if you're a woman and it's not your menstrual cycle and you're very sure it's coming out of your urine, then you need to seek medical advice because that can be a few things and that can actually be life-threatening. So make sure you go get that handled. It could be a tear, it could be a kidney stone, it could be bacteria, it could be fungal, it could be viral, it could be an STD, it could be acid, it could be an ulcer. Like there's so many different things. So go get that checked out. Don't leave it because the longer you leave it, remember, bacteria divide every 20 minutes. So if you're like, oh, I'll go next week, well, every 20 minutes, if it is a bacterial issue, you can make it where it's so bad where now it's creating more harm. And remember, bacteria, they move. So now the infection can spread.
And it is not normal even for one time to have any type of blood in urine. Is that correct?
Correct.
Okay.
Unless you're consuming red beets.
Yeah.
And it looks like blood. I've had patients where they've called me and they're like,
guilty.
I think I'm bleeding. And I'm like, are you eating red beets? They're like, yes, false alarm. Okay. So then we got it all covered.
Oh yeah.
Yeah. Because
I had that scare my first time when I was doing my beet juice back in my rowing days.
Yeah.
I almost passed out. I was like, what's going on?
Yeah, it's terrifying. So
it is actually.
Red beets.
I know, right? All right. And of course, telltale signs too, so our urine can also tell us things besides just clear and not be mindful of the smell. Ammonia was one, that acidic smell. Technically, outside of the first trip to the washroom in the morning, everything else should be clean and somewhat odor-free, I guess you would say.
Correct.
Truly? Yeah.
Yeah.
Okay.
Yeah.
Good. Any last thoughts for, so what would be your protocol, Ariel? Like, let's say that someone's coming in. I know you talked some solutions, but what would you do to determine maybe a kidney protocol for them?
So I always like to do my own testing. So we would do an organ test. We would hook you up to a quantum bioenergetic energy test where it will actually determine the spectrum of where your kidney function is at. Tell us if it's inflamed, tell us what's kind of going on. And then also take a look at all the other body systems because we want to make sure, well, is the kidney directly affected or is it indirectly affected that's caught, So we kind of take a look at the direction there. And so we would do something called a galvanic skin response. We would go through all the organ systems. Then we would hook you up to an organ scan. And then we would do some blood work called live blood and dry blood analysis. We would go through your health history, talk about all the fun stuff going in your body and get to know what is happening on a chemical level, right? We have to really understand what's happening. Are you smoking? Are you drinking? Like what's going on? So obviously you need to be honest. I've had a lot of people where they try to hide certain variables. And I'm like, no, I need to know. And if you've had 4 ventis from Starbucks, these are things I need to know.
Right.
You know? So just a couple little things there. And then we would get you on a water trial. So you get free water, free ionized water, and you just need to observe your pee, right? Report back to us, let us know how you're doing. And we would change your diet and put you on two supplements, the K and the chlorophyll, depending on dosages. And these are safe if you're on medications. We would just take 2 hours apart from your medications. So that's why we need to know. And we would just keep an eye on you for a couple weeks and bring you back in and see how you're doing for your monthly checkup. We would do all the testing all over again once a month until you're starting to see improvement.
Love it. Good. All right. Well, there you are. There are solutions out there. And what I love what you just said is it's not just here's a Band-Aid. It's no. We have to do an assessment. We have to fully understand all the parameters of what we're dealing with to then give you the best individualized approach. So
yes,
that's great. All right, Ariel, amazing conversation as always. Thank you for your insight, your education, and your humor. Never discount the humor in someone's life. I tell you, that's good. So,
well, thank you so much for having me. Always a good time, and look forward to next time.
All right. You got it. All right, gang. And just remember Vitality Wellness, vitalitywellnessw.com for any information to set up a consultation with Ariel. You can go on that website. There's information about some of the tests that she was just going over there too. And the first step is in your hands to achieve a better optimal health. So thank you for tuning in. Ariel, thank you. And we'll see you soon.
Bye.
Ciao, ciao.